I'd like to thank APOA for allowing me to give this talk on the utility of the Proximal Humerus Ossification System, or the PHOS, to guide brace weaning in adolescent idiopathic scoliosis. I have no disclosures. So we know for scoliosis treatment, identifying a curve progression risk is very important, and it is based purely on the curve magnitude as well as the patient's growth potential. And this gives us the better options for decision-making for treatment, such as bracing or surgery. Now, it's important to note that bone age has many different available indices for you to choose from. For the hand, we know that it's most accurate. However, it does require an additional X-ray. If we're looking at the same X-ray, Rizersine is one of the potential bone age assessments, but it's not sensitive and it's known to be very inaccurate. So we wanted to identify whether the proximal humerus epiphyseal ossification system can be seen on the same X-ray to assess its outcome with brace treatment, especially at the end of bracing. So we included all patients who were weaned bracing at Rizer stage 4 or more, with no changes in standing or sitting height in the past 6 months. And we including girls who are more than 2 years post-menarche. Now, we also included all patients with brace compliance of more than 16 hours a day to make sure that when we wean these patients off of bracing, that it's not due to the poor compliance that the patient got deteriorated, and make sure that they're actually a standardized post-weaning age so that we don't miss out on patients who are still growing. We also had a follow-up of 2 years post-weaning. We excluded all patients we couldn't see the PHOS classification and also lacked the same hand and day hand wrist radiograph for correlation. Now, so this is the PHOS classification we're focused on, grade 3, stage 3 to 5, which is the more of past peak growth and growth kind of stages. So stage 3 would be the lateral half of the thighs is still open without any obvious fusion. Stage 4 will be when the lateral half is thinning and begin to have partial fusion, and 5 is when there's complete fusion. We stratified our curves between less than 40 to more than 40 degrees to look at the effect of the large curve on the progression risk after weaning. We assessed all of these demographic parameters, such as sex, age, onset of menarche, body growth assessments, the curve type, and also the major Cobb angle. And the outcome was any increase of Cobb angle of more than 5 degrees, which indicates curve progression. So we had 107 patients, most of them females, mean Cobb angle of weaning of 35 degrees, and actually 32% of them did wean over 40 degrees. And we had a post-weaning follow-up of 3.4 years. Now, we found that the PHOS stage was particularly correlated to the radius grades of the distal radius and ulnar classification, with very significant statistical score. Now, this is the key feature which I want to present to you. If we're looking at the smaller curves, less than 40, when you have a PHOS classification of 4, in general would be quite safe. In addition, you can also use the radius at the same time. If radius 10, you can probably even go a little bit earlier with a PHOS of a 4 at the stage of radius 9. But if you want to just use the PHOS classification by itself, probably stage 5 is the clear-cut safest, where you don't have any curve progression after weaning. However, if we look at the over 40 degrees curve, these are large curves in which you probably want to at least get PHOS classification of 5 and a radius of more than 10. Because as you can see here, even with a radius grade 9 and a PHOS classification of 5, these patients will have some curve progression. Now, you may ask, why would that be the case if we have a consistent parameter? We've shown in many studies that using multiple parameters itself will actually fine-tune the growth to the most correct stage. So having 2 grades or more would be 2 indices or more would be the most accurate. So in general, PHOS has been found to be very useful for brace weaning. Stage 5 is probably the best stage for brace weaning, especially for the less than 40 degree curves, the smaller curves in which you have 0% progression rate. But if you look at the larger curves, you probably need to have additional parameter, such as the distal radius and ulnar with the radius grade of grade 10 to guarantee no progression after brace weaning. Now, important, as I mentioned, to reiterate that combining multiple maturity parameters will give you the most accurate prediction. Thank you.